Chapter 22, Hair Removal. Mastering the techniques of removing unwanted hair will be of great benefit to the professional cosmetologist because at some point nearly every client will encounter unwanted hair in some area or another. It can be extremely embarrassing and unattractive for female clients, especially when found on the face and chest. You need to be very sensitive when you're dealing with these clients that are having those issues. A short history of hair removal. The earliest method of hair removal was to use an abrasive, usually something like a pumice stone. This method was used by ancient Greek and Roman women. Native Americans used sharpened stones and seashells to rub the hair off, or they tweezed it out. Ancient Turks used a depilatory made of yellow sulfide of arsenic, quicklime, and rose water. They called this rusma. Most depilatories today also have an alkaline pH to assist in the decomposition of hair. Your primary clients are going to be women with their brows, their upper lip, face, arms, legs, bikini lines, pretty much anything. Male clients, we're seeing a lot more of this. Their back, their shoulders, the nape, and their chests. If they compete in sports like bicycling and swimming, it may facilitate faster competition times. Hirsutis is also known as hypertrichosis. It refers to the growth of hair on body parts that normally have only the lanugo or downy hair. There are two categories of removal, permanent and temporary. You should always do a client consultation. The main purpose of a consultation is determine if there's any reasons why you should not do hair removal on these clients. Those are called contraindications. You should have a questionnaire in place. Most product companies have their own questionnaire because of their ingredients in their removers. Make sure that you know what medications they're on, if there's any known skin disorders, or allergies. Some kind of a health screening form where they would put medications on or allergies. And a release form should always be signed before you do it. It will make them be more honest with you. Contraindication is a reason that you would not want to do a wax. Some of these words. A contraindication, isotretinoin use in the past 6 months, blood thinning medications, drugs for autoimmune diseases such as lupus, prednisone or steroids, psoriasis, eczema, or some other chronic skin disease, sunburn. You do not want to wax over a sunburn. Presence of pustules or papules in the area to be waxed. Recent cosmetic or reconstructive surgery, recent laser skin treatment, severe varicose veins, and anything other that's questionable. For facial waxing specifically, rosacea or very sensitive skin, a history of fever blisters or cold sores, a recent chemical peel using glycolic, salicylic, or other acid-based products, a recent microdermabrasion. That takes off the top layer of skin, and wax will do that also. So if the first layer is gone, you're getting into where you're going to have bleeding and scabbing. And then use of hydroquinone and that's used for lightening skin that's gotten darker. Permanent hair removal, electrolysis, photoepilation, and laser hair removal. Okay, these are your permanent hair removal types. Electrolysis is the removal of hair by means of an electric current that destroys the root of the hair. The current is applied with a fine needle-shaped electrode, and the electrode is inserted into the hair follicle. Little history of electrolysis. In 1875, this has been around a while, a St. Louis ophthalmologist, Charles Michel, he was trying to solve the problem of ingrown eyelashes. And what he did was he used galvanic current, which is a constant and direct current that causes chemical changes when it passes through the tissues and fluids of the body. This current chemically decomposed the papilla, which is the source of nourishment for the follicle. It was very tedious and very time consuming. In 1916, Paul Cree, a professor, developed a multiple galvanic machine, which is an epilator. It allowed the electrologist to insert up to 10 needles in a time sequence instead of spending so much time with one needle at a time. In 1924, so this is less than 100 years ago, a doctor from Paris developed thermolysis, which uses alternating current or high frequency current. This creates heat to destroy the dermal papilla. This was much faster than the previous ways. In 1945, there was a couple of guys, Henri St. Pierre and Arthur Hinkle. These guys blended galvanic current with low intensity, high frequency shortwave current running simultaneously through a single needle. This blend method destroys growth by using both galvanic current and heat. Photoepilation, also known as intense pulse light, it is the same thing. Uses intense light to destroy the hair follicles. Minimal side effects, no needles, can clear 50 to 60% of hair in 12 weeks. And it's administered by cosmetologists and estheticians. It depends on your state law. Laser hair removal, it's a laser beam that's pulsed on the skin, impairing the hair follicle. It's fast, and it is best if the hair is in the anagen stage. It takes more than one treatment. You are not going to get this done one time and have it be done. Coarse dark hair is going to respond the best, and it does require specialized training. Temporary methods of hair removal: shaving, we all know what that is, quick and convenient. Men's facial hair, women's legs and underarms. You can get some irritation, ingrown hairs, nicks from the blade. An electric clipper would count too, and your trimmers would count as that part of it. An electric clipper to remove unwanted hair at the nape of the neck. Tweezing, mostly we use tweezing to shape eyebrows and maybe a little bit around the mouth and the chin. The natural arch of the eyebrow follows the orbital bone, so you're going to always want to do a consultation and explain to a client that you need to work with the shape they already have, not just completely change it. And sometimes that's not possible. A depilatory is a substance, usually a caustic alkali preparation, used for the temporary removal of superfluous hair by dissolving it at the skin level. This is your neat and your nair. They contain detergents to strip oils from the hair. They contain adhesives to make that stick to the hair shaft for 5 to 10 minutes. The hair expands and the disulfide bonds break and they're absolutely destroyed. Sodium hydroxide, potassium hydroxide, thioglycolate acid, or calcium thioglycolate are used to destroy bonds. Same as what you're using in perming. If performed in the salon, always make sure you're doing a patch test with the depilatory. Epilators. These are things that just basically pull your hair out. Okay? Wax is an epilator. Hot or cold, usually made from resins and beeswax. Usually used on the brows, cheeks, chin, upper lip, arms, and legs. Sometimes the men like to have that done on the back of their neck. Hair should be at least 1/4 inch up to 2 inches long for waxing to be effective. And you should not remove vellus or lanugo hair, the little white downy hairs. You should not be taking those off because that can change that into terminal hair. Safety precautions. To prevent burns, test the wax temperature. Avoid wax contact with eyes. Do not apply over warts, moles, abrasions, or irritated or inflamed skin. According to your book, you are not to remove hair protruding from a mole. According to the nurses that I do in the salon, that is something that they were taught back in the day because they thought it might cause the mole to become cancerous. And they say don't even worry about it anymore. So I'm just saying, the book says don't do it. My nurses says you can. Use cold wax on sensitive underarm skin, and always use an aloe gel or something to calm that skin afterwards. Threading is a temporary method of hair removal practiced in a lot of Eastern cultures. You twist the thread around, it's rolled along the skin surface, entwining the hair in the thread, and then you pull it out. You do have to have training on this. And then sugaring is an epilator treatment that produces the same results as a hot or cold wax. It involves the use of a thick sugar-based paste and is especially appropriate for more sensitive skin types. The residue is then removed by dissolving it with warm water. That is chapter 22.